So remember, with a triangle of triage, if you have an IPSS or IBPSS of 8 and above, in combination with a post-void residual greater than 100, then it's time to have a deeper conversation about pursuing more investigation about your bladder health. So you can imagine, for men who are not emptying their bladders effectively, remember that it could be due to a pipe problem, that prostate's getting too tight, or a pump problem, the bladder's getting too weak, or some combination of both. But as a result, that flow may be slow, and as you are emptying your bladder, that flow may be slow, it may start and it may stop, it may take a long time to start. We're seeing that slowly fill up here, and let's say you're able to only empty that amount. Well, you can now see for this patient, he started here, but he was only able to empty maybe half of it. And actually, if we look here, it looks like 200 milliliters is left behind. And as you can see, that is above the threshold of 100 milliliters. So if you also had a combination of IBPSS 8 or above, now's the time to talk to your doctor a little deeper about getting a bladder health baseline. Welcome to BPH 360, where bladder health matters. I'm Dr. Kuang, Cleveland Clinic trained urologist. BPH is not just prostate enlargement. It's about protecting your bladder. Learn to ask better questions, take control. For education only, not medical advice. For your care, consult your doctor. If you are wondering why do we use a threshold cutoff for the triangle of triage of 100 milliliters, well, it's from the academic urologic literature. Here's a nice recent article from 2025, The Underappreciated Underactive Bladder. It presents a practical evaluation pathway from our colleagues in Australia. In this pathway, where men have urinary symptoms, you see this at the top, they will then first undergo testing. And you'll note it includes two of the ones that are really important with the triangle of triage. One is the flow rate, the Qmax, the next vital sign for men to assess bladder health. But also the PVR, and you can see that here, post-void residual. Then they use a criteria just like the man versus prostate triangle of triage of 100 milliliters, and we see that here. When that PVR is greater than 100 milliliters, the path now moves to a camera, more advanced testing, specifically here called a cystoscopy. Now, it may differ depending on where you are in the world, but when we see a combination of symptoms, for us, it's an IPSS or IBPSS of 8 and above in combination with quantitative data such as a PVR of at least 100 milliliters, that is now triggering a deeper investigation. And similar to the Australian pathway here, we also believe it starts with a minimum of a camera looking on the inside, which is called a cystoscopy. Now, a quick preview about this advanced testing of a camera called cystoscopy. When we're able to place a camera and look on the inside, there's just so many variables that we can gain insight about. So much more data about the prostate size, the prostate shape, as well as the status of bladder health. We can actually begin to see how healthy or not healthy the bladder is. Are we seeing evidence, all these lines, those trabeculations, if you remember from previous episodes, evidence that the bladder's not working as well. We can also, for some men, do a test and actually watch how the bladder and the prostate work together to empty the urine. Additionally, remember, there's always diagnostic uncertainty, and there can be other causes of symptoms that have nothing to do with a prostate getting tighter from BPH PBO. For example, you could have bladder tumors, you could have bladder cancers, you could have bladder stones, or even scar tissue. So these are all things that are very important to rule out in your evaluation. All right, now back to this episode about post-void residual and how well do you empty. So yes, this academic recent review from Australia closely parallels our man versus prostate triangle of triage. Remember, if you have a post-void residual of 100 milliliters or more, it does not prove anything. It does not prove that you have bladder failure, but it does mean that you have enough evidence to stop assuming and to start investigating, to start diving a little deeper to see what's going on. Is there a pipe problem, a pump problem, or some combination of both? And now to round it out, I just want to show you that our academic colleagues in Europe have done a nice job of beginning to add another level of depth to your understanding in this 2024 summary of an underactive bladder, where they're able to differentiate the care based on certain thresholds of your post-void residual. When they start to see evidence of that constellation of symptoms that may be consistent with an underactive bladder, in addition to a post-void residual that's between 100 and 300, they are asking your urologist to begin discussing with you behavioral recommendations, double voiding, pelvic floor relaxation. And now you may one day need to start using catheters to drain your bladder if that bladder is getting too weak. Now on the far right, if you have post-void residual of greater than 300, then they are recommending that you initiate learning how to either place a catheter in yourself to drain your bladder, or if that's not possible, having a catheter placed all the time, because that bladder-prostate relationship's not working effectively enough to ensure that you're emptying out your bladder efficiently. So returning back to the man versus prostate triangle of triage, 100 milliliters is not a universal diagnosis. It is not an automatic order for a catheter. It is merely a threshold that should get your attention, should get your physician and urologist's attention, especially when it's combined with an IPSS or IBPSS of 8 or above. And remember, you can go to the Man vs. Prostate website to find out what your number is. And as well, if you're in North America, do that phone test to see how fast your urinary stream is. What is your Qmax, your next vital sign for your bladder health? Quick pause. This is a serious moment. If your urine flow is very slow or you're having worsening urgency, leakage, or retention, that can be late-stage disease. At that point, supplements and pills may not be enough. On manvsprostate.com, there are simple tools to help you see where you may be on the bladder health stages and whether it's time not to wait and to go see your doctor and to ask, what about my bladder? Learn more at manvsprostate.com. Back to the episode. Let me show you what a post-void residual really means. Remember, imagine this is your body. Here is your bladder. Here's your prostate. Remember, it's the size, starts off about the size of that golf ball. And as it gets bigger, that donut hole is going to start to get tighter. Now that bladder is working harder. And we all go through that process for urination, right? The urine from your kidneys comes down to your bladder. In fact, you can see the two holes where it's going to be coming into the bladder. That bladder then is going to fill. And then when you deem it socially appropriate, you're going to then go to the bathroom and empty your bladder, right? And so you'll empty a certain amount. And the amount left over is your post-void residual. So just to show it more dynamically, I just want to give you an idea. You know, it's pretty standard that most guys, this is a pretty normal average volume that your bladder will fill up before you go use the bathroom. So this is a can of Coke Zero, no disclosures. I just had it in the fridge. And this is going to be about 355 milliliters or 12 fluid ounces. So that's that amount. And you'll see, actually, I put about the same amount in a graduated cylinder so we can just do some basic measurement. And so once again, this is the average volume, 350, that you'd find in a can of Coke, Pepsi, whatever you prefer to drink. And here is that cutoff that we've been talking about of 100. So remember, with the triangle of triage, if you have an IPSS or IBPSS of 8 and above, in combination with a post-void residual greater than 100, then it's time to have a deeper conversation about pursuing more investigation about your bladder health. So you can imagine, for men who are not emptying their bladders effectively, remember that it could be due to a pipe problem, that prostate's getting too tight, or a pump problem, the bladder's getting too weak, or some combination of both. But as a result, that flow may be slow, and as you are emptying your bladder, that flow may be slow, it may start and it may stop, it may take a long time to start. We're seeing that slowly fill up here, and let's say you're able to only empty that amount. Well, you can now see for this patient, he started here, but he was only able to empty maybe half of it. And actually, if we look here, it looks like 200 milliliters is left behind. And as you can see, that is above the threshold of 100 milliliters. So if you also had a combination of IBPSS 8 or above, now's the time to talk to your doctor a little deeper about getting a bladder health baseline. And so really what we're trying to do is get you to a point where if you empty well enough, and we can see that here, perhaps that's pretty close, a little under. So if this guy came in and he's emptying now under 100, that is a more favorable sign. But remember, you can't just automatically assume that everything is actually okay, even if this number is less than 100, right? So it's really just one more data point that you need to consider, and especially when it's in combination with your IBPSS 8 and above, and if that PVR, post-void residual, is greater than 100, definitely need a conversation. To help clarify, for most, an IBPSS 8 and above alone should be a reason to discuss with your urologist or physician more about your bladder health, without a doubt. But even more so, if you now have measurable data where your PVR is greater than 100, then please, that should trigger a bladder health baseline discussion and deeper investigation. And I also just want to clarify, even if your PVR is less than 100 and you're still having moderate symptoms, at least moderate symptoms or even severe symptoms, you still need to have that dialogue. Just because your number's under 100 does not mean automatically that you don't have a problem that's affecting your bladder health, that's causing your bladder to struggle and have bladder dysfunction and bladder disease. For those of you in higher income healthcare systems, there's obviously going to be some nice technology that exists out there to help scan and see how well you're emptying. Here is a handheld bladder scanner that uses ultrasound or sound waves to estimate how well you empty, how much urine remains after you urinate. It's quick. It does not require a catheter. Ideally, it should happen immediately after you've gone to the bathroom to urinate or shortly thereafter. Then there's an added level of technology out there where you can have a similar handheld wand to do a similar thing where we're scanning the bladder to see how much remains. But what's nice about this is now we're able to connect it with an iPad. And for example, we can now start to actually get imaging of the bladder in real time to be able to exactly measure the bladder and get a sense of how much urine is left behind. And then finally on the screen, you'll see that you can even get bigger machines that can add a lot more detail in addition to the post-void residual. And finally, whether it's a lower income healthcare system or a higher income healthcare system, remember that there's always those catheters. It's a tried and true way where you're actually going in and placing a catheter gently, softly, with a lot of lubrication into the bladder, and we can then drain the bladder and actually just measure it, how much urine comes out, put it in a graduated cylinder, and we can measure the actual amount of urine left behind, your PVR. And then finally, we physicians and urologists should not forget the physical exam. So you can imagine if this is the patient and he's laying flat, as the amount of urine that is left behind gets larger and larger. And I've had guys where they literally have had as much as this whole container was their PVR. If they're thin enough, you can actually put your hand on the lower abdomen, their lower belly, right above the pubic bone, and you can actually feel that the bladder is distended after they have thought that they've emptied when they've gone to the bathroom. Once again, that's a way to crudely assess that the post-void residual is too high. So here's the main lesson from this episode. You cannot know how well your bladder empties based only on how you feel. You may have a slow stream from a tight prostate, a pipe problem. You may have the urgency frequency from an overactive bladder. You may have also developed an underactive bladder at the same time. Multiple stages can coexist, symptoms overlap, diagnostic uncertainty always exists. That is why data matters. Know your IBPSS or IPSS, your Qmax, and your PVR, your post-void residual. In the triangle of triage, an IBPSS or IPSS 8 and above, together with a post-void residual greater than that magic number of 100 milliliters, is definitely a trigger that says you need to have a deeper investigation and that dialogue about bladder health, because you may have a bladder at risk for dysfunction and disease. Like the Australians and Man vs. Prostate, the first step may include a camera, a cystoscopy, which we will talk about in future episodes, where it's a camera to look at the prostate size, the shape, as well as the condition of the bladder, and to make sure there's not other causes of these symptoms, such as bladder tumors, bladder cancer, scar tissue, or even bladder stones. Until then, ask that golden question, what about my bladder? Please protect your bladder before it is too late. Thanks for watching. If bladder health matters to you, watch more. Follow BPH360 to stay ahead of your symptoms. Listen on Spotify and Apple Podcasts.